NMC CBT questions and answers. Question number 301. Under the Carers, Equal Opportunities Act, 2004, what are carers entitled to? Option A, their own assessment. Option B, financial support. Option C, respite care. Option D, all of the above. The correct answer is option D, all of the above. Question number 302. What infection control steps should not be taken in a patient with diarrhea caused by Clostridium difficile? Option A, isolation of the patient. Option B, all staff must wear aprons and gloves while attending the patient. Option C, all staff will be required to wash their hands before and after contact with the patient, their bed linen and soiled items. Option D, oral administration of metronidazole, vancomycin, fidaxomicin may be required. Option E, none of the above. The correct answer is option E, none of the above. Question number 303. If a patient requires protective isolation, which of the following should you advise them to drink? Option A, filtered water only. Option B, fresh fruit juice and filtered water. Option C, bottled water and tap water. Option D, tap water only. Option E, long life fruit juice and filtered water. The correct answer is option E, long life fruit juice and filtered water. Question number 304. If you were told by a nurse at handover to take standard precautions, what would you expect to be doing? Option A, taking precautions when handling blood and high-risk body fluids so that you don't pass on any infection to the patient. Option B, wearing gloves, aprons and mask when caring for someone in protective isolation to protect yourself from infection. Option C, asking relatives to wash their hands when visiting patients in the clinical setting. Option D, using appropriate hand hygiene, wearing gloves and aprons when necessary, disposing of used sharp instruments safely and providing care in a suitably clean environment to protect yourself and the patients. The correct answer is option D, using appropriate hand hygiene, wearing gloves and aprons when necessary, disposing of used sharp instruments safely and providing care in a suitably clean environment to protect yourself and the patients. Question number 305. Mrs. Smith is receiving blood transfusion after a total hip replacement operation. After 15 minutes, you went back to check her vital signs and she complained of high temperature and loin pain. This may indicate option A, renal colic. Option B, urine infection. Option C, common adverse reaction. Option D, serious adverse reaction. The correct answer is option D, serious adverse reaction. Question number 306. The nurse needs to validate which of the following statements pertaining to an assigned client. Option A, the client has a hard, raised, red lesion on his right hand. Option B, a weight of 185 pounds is recorded in the chart. Option C, the client reported an infected toe. Option D, the client's blood pressure is 124/70. It was 118/68 yesterday. The correct answer is option C, the client reported an infected toe. Question number 307. Which of the following are not signs of a speed shock? Option A, flushed face. Option B, headache and dizziness. Option C, tachycardia and fall in blood pressure. Option D, peripheral edema. The correct answer is option D, peripheral edema. Question number 308. A patient has collapsed with an anaphylactic reaction. What symptoms would you expect to see? Option A, the patient will have a low blood pressure, hypertensive, and will have a fast heart rate, tachycardia, usually associated with skin and mucosal changes. Option B, the patient will have a high blood pressure, hypertensive, and will have a fast heart rate, tachycardia. Option C. The patient will quickly find breathing very difficult because of compromise to their airway or circulation. This is accompanied by skin and mucosal changes. Option D. The patient will experience a sense of impending doom, hyperventilate and be itchy all over. The correct answer is option C. The patient will quickly find breathing very difficult because of compromise to their airway or circulation. This is accompanied by skin and mucosal changes. Question number 309. After lumbar puncture, the patient experienced shock. What is the etiology behind it? Option A. Increased ICP. Option B. Headache. Option C. Side effect of medications. Option D. CSF leakage. The correct answer is option D. CSF leakage. Question number 310. Which of the following is not a criteria for anaphylactic reaction? Option A. Sudden onset and rapid progression of symptoms. Option B. Life-threatening airway and/or breathing and/or circulation problems. Option C. Skin and/or mucosal changes, flushing, urticaria and angioedema. Option D. Skin and mucosal changes only. Option E. A and B only. Option F. All of the above. Option G. A, B and C. The correct answer is option D. Skin and mucosal changes only. Question number 311. The following are ways to remove factors that trigger anaphylactic reaction except for one. Option A. It is not recommended to make the patient should not be forced to vomit after food-induced anaphylaxis. Option B. Definitive treatment should not be delayed if removing a trigger is not feasible. Option C. Any drug suspected of causing an anaphylactic reaction should be stopped. Option D. After a bee sting, do not touch the stinger for about a maximum of 3 hours. The correct answer is option D. After a bee sting, do not touch the stinger for about a maximum of 3 hours. Question number 312. Normal heart rate for 1 to 2 years old. Option A. 80 to 140 beats per minute. Option B. 80 to 110 beats per minute. Option C. 75 to 115 beats per minute. The correct answer is option B. 80 to 110 beats per minute. Question number 313. As you visit your patient during rounds, you notice a thin child who is shy and not mingling with the group who seemed to be visitors of the patient. You offered him food, but his mother told you not to mind him as he is not eating much while all of them are eating during that time. As a nurse, what will you do? Option A. Inform social service desk on suspected case of child neglect. Option B. Ignore incident since the child is under the responsibility of the mother. Option C. Raise the situation to your head nurse and discuss with her what intervention might be done to help the child. The correct answer is option C. Is raise the situation to your head nurse and discuss with her what intervention might be done to help the child. Question number 314. A nurse finds it very difficult to understand the needs of a child with learning disability. She goes to other nurses and professionals to seek help. How you interpret this action? Option A. The nurse is short of self-confidence. Option B. A nurse, who is well aware of her limitations, seek help from others. She worked within her competency. Option C. She doesn't have the kind of courage a nurse should have. The correct answer is option B. A nurse, who is well aware of her limitations, seek help from others. She worked within her competency. Question number 315. Fred is going to receive a blood transfusion. How frequently should we do his observations? Option A. Temperature and pulse before the blood transfusion begins, then every hour, and at the end of bag unit. Option B. Temperature, pulse, blood pressure and respiration before the blood transfusion begins, then after 15 minutes, then as indicated in local guidelines, and finally at the end of the bag unit. Option C, temperature, pulse, blood pressure and respiration and urinalysis before the blood transfusion, then at end of bag. Option D, pulse, blood pressure and respiration every hour, and at the end of the bag. The correct answer is option B, temperature, pulse, blood pressure and respiration before the blood transfusion begins, then after 15 minutes, then as indicated in local guidelines, and finally at the end of the bag unit. Question number 316. Where is revision on the nursing process done? During. Option A, diagnosis. Option B, planning. Option C, implementation. Option D, evaluation. The correct answer is option D, evaluation. Question number 317. What is comprehensive nursing assessment? Option A, it provides the foundation for care that enables individuals to gain greater control over their lives and enhance their health status. Option B, an in-depth assessment of the patient's health status, physical examination, risk factors, psychological and social aspects of the patient's health that usually takes place on admission or transfer to a hospital or healthcare agency. Option C, an assessment of a specific condition, problem, identified risks or assessment of care, for example, continence assessment, nutritional assessment, neurological assessment following a head injury, assessment for daycare, outpatient consultation for a specific condition. Option D, it is a continuous assessment of the patient's health status accompanied by monitoring and observation of specific problems identified. The correct answer is option B, an in-depth assessment of the patient's health status, physical examination, risk factors, psychological and social aspects of the patient's health that usually takes place on admission or transfer to a hospital or healthcare agency. Question number 318. All but one describes holistic care. Option A, a system of comprehensive or total patient care that considers the physical, emotional, social, economic, and spiritual needs of the person, his or her response to illness, and the effect of the illness on the ability to meet self-care needs. Option B, it embraces all nursing practice that has enhancement of healing the whole person from birth to death as its goals. Option C, an all nursing practice that has healing the person as its goal. Option D, it involves understanding the individual as a unitary whole in mutual process with the environment. The correct answer is option C, an all nursing practice that has healing the person as its goal. Question number 319. The rehabilitation nurse wishes to make the following entry into a client's plan of care. Client will establish a pattern of daily bowel movements without straining within 2 months. The nurse would write this statement under which section of the plan of care? Option A, long-term goals. Option B, short-term goals. Option C, nursing orders. Option D, nursing diagnosis problem list. The correct answer is option A, long-term goals. Question number 320. In caring for a patient, the nurse should: Option A, whenever possible, provide care that is culturally sensitive and according to patient's preference. Option B, ask the patient and their family about their culture. Option C, be aware of the patient's culture. Option D, disregard the patient's culture. The correct answer is option A, whenever possible, provide care that is culturally sensitive and according to patient's preference. Option B, ask the patient and their family about their culture. Option C, be aware of the patient's culture. Question number 321. Hospital discharge planning for a patient should start. Option A, when the patient is medically fit. Option B, on the admission assessment. Option C, when transport is available. The correct answer is option B, on the admission assessment. Question number 322. How do you value dignity and respect in nursing care? Select which does not apply. Option A, we value every patient, their families or carers, or staff. Option B, we respect their aspirations and commitments in life, and seek to understand their priorities, needs, abilities and limits. Option C, we find time for patients, their families and carers, as well as those we work with. Option D, we are honest and open about our point of view and what we can and cannot do. The correct answer is option D, we are honest and open about our point of view and what we can and cannot do. Question number 323. What are the professional responsibilities of the qualified nurse in medicines management? Option A, making sure that the group of patients that they are caring for receive their medications on time. If they are not competent to administer intravenous medications, they should ask a competent nursing colleague to do so on their behalf. Option B, the safe handling and administration of all medicines to patients in their care. This includes making sure that patients understand the medicines they are taking, the reason they are taking them and the likely side effects. Option C, making sure they know the names, actions, doses and side effects of all the medications used in their area of clinical practice. Option D, to liaise closely with pharmacy so that their knowledge is kept up to date. The correct answer is option B, the safe handling and administration of all medicines to patients in their care. This includes making sure that patients understand the medicines they are taking, the reason they are taking them and the likely side effects. Question number 324. What are the most common types of medication error? Option A, nurses being interrupted when completing their drug rounds, different drugs being packaged similarly and stored in the same place and calculation errors. Option B, unsafe handling and poor aseptic technique. Option C, doctors not prescribing correctly and poor communication with the multidisciplinary team. Option D, administration of the wrong drug, in the wrong amount to the wrong patient, via the wrong route. The correct answer is option D, administration of the wrong drug, in the wrong amount to the wrong patient, via the wrong route. Question number 325. Independent and supplementary nurse and midwife are those who are option A, nurse and midwife student who cleared medication administration exam. Option B, nurses and midwives educated in appropriate medication prescription for certain pharmaceuticals. Option C, registrants completed a program to prescribe under community nurse practitioners drug formulary. Option D, nurses and midwives whose name is entered in the register. The correct answer is option B, nurses and midwives educated in appropriate medication prescription for certain pharmaceuticals.